but we have Dr.
You.
I'm glad he's
It's a tough name, Herman.
I know. Well, I mean, why you is like you look at that.
It's a real tough name.
Should I say it like it looks? And the answer is yes.
Yes.
And his wife, Kate. Good to have you
Yes.
guys.
It's good to be here.
We're blessed. This book, which you're going to see a website often, and you really need to get a copy because I read it. It is absolutely worth taking your time. In fact, what is amazing, it's the kind of book that when you go through it, you start saying, that's me. And then you go, oh, that's me. I've had that. So you
got about everything in the book, Herman?
Well, I don't know. I guess it's because maybe most people do that. But it's amazing how you have pinpointed so many things in the human body. And that's why I like this kind of medicine.
Yes.
Because it's the way God made the body, and you prove that the body can heal itself if you do the right things.
Correcting the underlying problems.
Yeah.
Yes.
Give me a little of your background.
Well, I'm originally from Korea, and my medical background is I'm a board certified internist. So I'm a MD, and I work for managed care for almost 10 years. And I decided to leave because what we are doing is just managing the disease. We're not really curing the underlying problem. So I left, and I've been investigating this alternative complementary medicine for the last 20 years. And I've been writing the articles for the last almost 20 years, and I decided I need to write this into a book, let people know about what this is about, because there are so many people who go through suffering because they never get to the underlying problems.
Yeah.
So part of I cannot claim anything because our body heals itself, so we can call it as a spontaneous healing, or I like to call it accidental cure,
Okay,
if you
now,
correct all the underlying problems.
That was going to be my next question. Accidental cure, because it's throughout the Bible. Throughout the Bible. See, I got
No.
Bible on my mind. It's throughout the book. Accidental cure. Follow that in your book.
The idea is, first of all, as a physician, we cannot really claiming cure any disease. We can say we can manage the diabetes, we can manage the cancer or heart problems. So we really can. So legally, it's hard to claiming ourselves we can cure any disease. But if we can correct those underlying problems, like a hidden dental problem, hidden infections, especially like parasite problem, allergy problems, nutritional support, and cleansing, our body began to heal at a different rate for everybody. Is different pace, and now we can say patient get better. And sometimes people think they are cured, and well, I cannot claiming it, so why not call it as a accidental cure? I'm not going to be responsible for your cure. You cure yourself, and I'm just promoting that to happen. That's my idea.
Keeps you away from malpractice, doesn't it? Accidental.
And I'm not responsible for your
exactly.
cure.
That's right. That's
Kate,
right.
you met this guy how?
Working together at an HMO when he was the medical director. I was in the sales and marketing department. Later, I ended up going into developing my own job as a patient advocate.
Oh,
So that's how I
great.
met him.
Did you, when you heard him diagnosing and talking to people, you must have thought, that is one smart dude.
Actually, when I had really difficult patients, I would call him and say, please take care of this patient. And he'd say, I love difficult problems. So he was always so helpful.
Oh, that's great.
You talk about in the book patients who are candidates for extreme medicine. Extreme medicine. What is that talking about?
I'm talking about outside the box. Now, if somebody...
You're talking about what now?
Outside the box. Think outside the box.
Okay.
So somebody comes with unexplainable symptoms, either fatigue, pain, or some unusual cancer or tumor developing, and they have done every known test, all the blood tests, X-ray, CT scan, MRI, PET scan, and they still don't know what is going on. Now we are forced to look into outside the box. So when you get into the outside the box, usually our medical professional people say, well, that's totally, that's like a totally outside the standard. There's nothing is proven. Sort of they don't take it seriously.
Because they must have research, right? Many people, unless they have a lot of research, they don't want to assume you know what you're talking about.
Well, there is no, once you get into other alternative complementary medicine, there is no what I call double-blind control studies. It's a lot of them are empirical, but we cannot reproduce it another patient because they may require different kind of therapy. So it's very hard to make that kind of a control studies when you're getting into the outside the box. So that's what I call extreme medicine for extreme patients, what the unusual cases we were talking about.
So what do you do when that patient comes to you and has had all these tests and everything and the doctor still can't find out what's wrong with them? What's the first thing you do for them?
Yeah, I measure the acupuncture meridian, the energy flow of our body.
Okay, now you have that throughout the book. So the book, I mean, goes in detail. It doesn't, we're just covering the surface right here. But you go into detail and you talk a lot about acupuncture. Now, how were you first introduced to that method?
Actually by dentist.
A dentist?
Yes. Dr. Douglas Cook from small town in Wisconsin. I was in Chicago for his conference, and it was hard for me to believe that it is possible that how dental caused so many unexplainable medical problems.
Now, we're going to go into that because in reading the book, it's amazing what the problem with your teeth or any gum problems, root canals, you go into detail of why that could be the catalyst for what is going on in the body.
That's right. So Dr. Cook introduced how to detect a dental problem by understanding meridian system, how to measure how your meridian system is running, because all the meridians are running through your jaw and through your dental point.
Now, you say that again because I'm not picking it up here, so they're not picking it up there. Say that again.
The dental and meridian go through the whole system.
Okay, what is meridian?
The energy flow of our body that has been known for thousands of years. This is not a new information, but new way of measuring it. The old acupuncturists feel your pulse to see which meridian is out of balance. But for the last 60 years, it's a German medical doctor named Dr. Voll developed this technique to measure electrical current running through in your acupuncture point to see which meridian is balanced and which meridian is out of balance. And most of those meridians go through your dental and your jaw point.
Now, you know, it's really funny you say that because about 7 years ago, I started having problems, and it was
Medical
right
problems.
after
Yeah.
I had a root canal done.
Yeah.
Yes.
And in my own self, it's how you can almost analyze yourself sometimes, it seemed like it stemmed from the time I had that root canal done, that I started getting these kind of lupus problems. I wasn't off then. It probably was.
No, after reading his book, honey, you were right on. I mean, in the book, he's got page after page going into, okay, now.
So I do have a case study actually with the lupus and autoimmune disease. That case has a dental problem, infections, heavy metal problem, parasite problem, allergy problem, and able to reverse the whole, the antibody titers for ANA, C-reactive protein, cell rate, all back to normal. Those lab tests define you have autoimmune disease and lupus.
What does, I mean, here's a root, he has, even a diagram and a display of showing what a root canal will do to the system. Give us a little taste of what is in the book.
The danger of the root canal inflammation has been known for over 70 years. Dr. Weston Price is a dentist. He was also chief scientist for American Dental Association, was studying this and published in about 1,100-page report, a detailed experiment he did on animals and also on humans about the danger of this root canal can cause pericarditis, chest pain, endocarditis. It can cause rheumatism, lupus-like symptoms, arthritis, fibromyalgia-like symptoms, neurologic symptoms, mental disorders, all those associated with root canals.
In fact, you say in the book, one individual that thought they had, or diagnosed with fibromyalgia,
Right.
discovered through this kind of analysis that they didn't have fibromyalgia.
Right, because fibromyalgia is just symptoms. It can be
The
caused
soreness and all of that.
by,
Yeah.
It's
it
just
can
symptoms.
be right. It can be caused by dental problem, but it could be maybe allergy problem or other kind of infections and parasite. In the book, talk about one case diagnosed with fibromyalgia and respond to parasite medication. Another patient may
Now,
put in the root
explain,
canal.
okay, let's stop right there. Parasite medication, what is that about?
Yeah, this is another my real emphasis on dental and parasite.
Okay.
Now, typical Americans don't ever thinking about parasite infection is so common, but we overlook.
Yeah.
And the reason I able to pick up was, first of all, I was checking the meridian system. They would give you informational clue. And I was in Bolivia. I was in the U.S. Army, part of the peacekeeping mission. I was in La Paz and Oruro. And we are dispensing basically everybody parasite medications. One of the cheapest parasite medications available, mebendazole and parental palmoate. Those are relatively inexpensive parasite medications. We're just handing out to everybody to take it. And then very few days later, or sometimes very next day, they bring this, jar, the parasite, or some of them describing how the parasite coming out of their skin.
Oh my goodness.
That was year 2000. And since then, I have been using some of those medications on my patients, and I realized that not only help you for your gut, for irritable bowel syndrome and colitis, they say their asthma improves. Sometimes the asthma disappears. Their migraine headache disappears. Sometimes the brain lesion disappears, the tumor disappears, and it's like, this is not possible. There's no medical textbook ever describe this phenomenon. So I've been writing and documenting these cases, and I said, I need to write this into a book, let people know. Parasite is a major epidemic problems in the United States.
You think this in a third world,
Right.
Yeah.
but you don't think about this in the United States of America. But where do we acquire parasites? From what?
It can be from food, from the water supply, but also it can be from the air. The
Wow.
eggs in the air from the animals, dog, cats, and just everywhere. It's available, just it's floating around. And just think about Florida, or like California. There's so many immigration, the migration from South America, and they are very well aware of the parasite problem. And they may have a parasite with them in Florida. But you don't have to be in Florida. Actually, I see a lot of patients from Iowa. And I usually make fun of those people from Iowa. They say, you came all the way down from Iowa to be dewormed. They drive 7-8 hours just to get dewormed when the vet can actually take care of them. And many of them are farmers, and I give common medication that they're familiar with. Ivermectin, parental palmoate, mebendazole, and he goes, oh yeah, I use this for my horse. I use it for my dog and for my sheep. And I say, well, I'll take this, no problem. And they feel better. The problem disappears. All this, I'm talking